Three illnesses converging at the same time, leading to more hospitalizations in southeast Wisconsin. Mary Jo Ola joins us live outside Frederick, where they say COVID is not the only concern right now. Mary Jo.
Carol, with people relaxing their approach to face masks and other prevention methods, hospitals are seeing an uptick in cases. This season, they're seeing a cross-section of respiratory virus infections. This season, Jennifer Sowa and her family made sure they all got their flu shot.
We're just trying to be as careful as we can during this flu season, so hopefully we'll stay healthy.
Dr. Mary Beth Graham is the medical director of infection prevention and control at Frederick Hospital. She says this year, respiratory viral infections are showing up in interesting ways.
Last year, we had absolutely zero hospitalizations for influenza last year. We've already had hospitalizations for influenza this year. So that's what's different. And then we still have SARS-CoV-2, COVID-19, unfortunately, leading to a number of hospitalizations.
RSV cases and hospitalizations surged over summer, which was unusual. State data shows RSV cases dropping since September, but flu numbers are rising statewide, with 428 confirmed cases in the most recent report. Some people tell us this year they're even more aware if they're feeling unwell to avoid others.
I think that if everybody was able to kind of keep that mindset of everybody's going through the same thing, we're in this as a collective, I feel like that would be a great way to stay healthy for everybody.
The trends come as mitigation efforts like masking fall by the wayside. Dr. Graham says she's worried about health systems getting overwhelmed by people with symptoms.
It may deter others who are at that high risk of not coming in to seek health care, or trying to come in and waiting rooms that are just overwhelmed and it taking a long time to get in.
Now, since flu, RSV, and COVID-19 can share similar symptoms, Dr. Graham says testing is the only way to determine exactly what it is. Mary Jo Ola, TMJ4 News.
That's a lot to deal with, Mary Jo. Thank you very much. Now, the latest COVID numbers are in from the state. Our Charles Benson has been analyzing those numbers. Charles, what did you discover?
Well, certainly a one-day increase in cases. The state reporting more than 4,600 cases. And when you see like Green Bay, Milwaukee, Madison, the darker reds there, that means where you're seeing a higher case count, but not necessarily a higher activity. I'll explain that in a second. But that number today is definitely above the 7-day trend. And we do want to keep an eye on the 7-day trend here because it really gives us a clearer picture. And when we look at that 7-day trend, cases among kids remains about a third of the new cases. Now, when I talk about what's happening across the state, let's look at the per population. Right now, 80 cases per 100,000. But when you click on some of these other counties, look what's happening. It's a lot higher and hotter in some of the other counties across the state. Carol?
Very interesting.